My name is Dr. Rachel Kopicki, and I'm here to talk to you about the importance of prediabetes. Here at Valley, we treat patients in South King County where there are high rates of both diabetes and prediabetes. Because of that, one of our hospital goals is to educate community members and patients about the importance of this disease, particularly because those who have it often don't know that they have it. We hope you watch this video to learn more about prediabetes and how you can prevent it.
Prediabetes. You have prediabetes if your blood glucose level is higher than normal, but not high enough for you to be diagnosed with type 2 diabetes. You can have prediabetes without being aware of it. To fully understand prediabetes, it helps to know how food is digested. Your body needs a form of sugar called glucose for growth and energy. You get glucose from foods and from some drinks. Food is broken down into glucose in your digestive tract. From there, it enters your bloodstream and moves into your body's cells. The pancreas is an organ that sits behind your stomach. This organ makes a hormone called insulin and sends it into the bloodstream. Insulin is carried through the blood and attaches to the surface of cells. This creates a path for glucose to move inside the cells. The cells can then function and grow. If you have diabetes, the pancreas doesn't make enough insulin, or your body becomes resistant to insulin and can't process glucose that well. When this happens, glucose stays in the blood and doesn't move into cells. Your body's cells become starved for energy. If you have prediabetes, it means that your body is already having problems with the normal process of insulin and glucose. You have a bit too much glucose in your blood, and you're at higher risk for developing type 2 diabetes. Testing for prediabetes. Prediabetes usually has no symptoms. It can be found with a blood test called a fasting plasma glucose test. This test measures your blood glucose after you have not eaten for at least 8 hours. The fasting blood glucose range for prediabetes is between 100 and 125 milligrams per deciliter. Another test is the hemoglobin A1C test. This shows what your average blood sugar was over the last few months. The A1C range for prediabetes is between 5.7% and 6.4%. Treating prediabetes. The best way to treat prediabetes is to lose extra weight and be more physically active. Don't let more than 2 days go by without exercise. Break up periods of sitting with light activity every 30 minutes. These changes help the body's cells use blood sugar better. Even a small amount of weight loss can help. Work with your healthcare provider to make a plan to eat well and be more active. Keep in mind that small changes can add up in positive ways. Other changes in your lifestyle may also make you less likely to develop diabetes. Many people with prediabetes carry extra fat around the waist. Often they don't get enough exercise, and they tend to have a hard time controlling their blood fats, such as cholesterol and triglycerides. They often have high blood pressure. The combination of these problems plus prediabetes is called metabolic syndrome. People with metabolic syndrome must control these health issues to prevent type 2 diabetes, heart disease, and stroke. What to do? If you're overweight, make a plan to lose some weight. Try eating smaller amounts of healthier food. Eat less saturated and trans fat. Don't eat as much of the kind of fats found in cheese, butter, fried foods, and packaged snack foods. Instead, choose healthy fats like those found in avocados, olive oil, or peanut butter. Choose lean meats such as chicken or turkey and fish such as salmon or tuna. Eat fewer foods like burgers, pizza, and hot dogs. Have your blood glucose checked as often as your healthcare provider says you should. This will help you both see how lifestyle changes can affect your blood sugar over time. Prediabetes can lead to serious problems, but learning about it and the changes you can make is your first step to better health. What we have learned. Prediabetes means you are at a higher risk for developing diabetes. True or false? The answer is true. People with prediabetes are more at risk for type 2 diabetes. Prediabetes usually has no symptoms and can only be diagnosed with blood tests. True or false? The answer is true. You may have a fasting plasma glucose test or hemoglobin A1C blood test to check for prediabetes. If I am diagnosed with prediabetes, weight loss is one treatment. True or false? The answer is true. People who carry extra weight around their waist often have a higher risk of getting prediabetes. Making healthy food choices and getting regular exercise may help your blood sugar go back to normal. It may also keep you from getting type 2 diabetes in the future.
Thank you for watching. If you're concerned that you or a family member may have prediabetes, you can schedule an appointment with a primary care provider at Valley Medical Center by visiting the link to our website below, where you can find a clinic and provider near you.